So you treat sleep apnea?
Yes, Randy, we do. Sleep apnea is a really big problem. I'm sure, or maybe you're not aware, that many people snore a lot when they sleep. When you snore, the airway collapses, and that's what makes the noise. The front and the back of your throat are vibrating together. Many studies have been done now, and that it actually affects your heart, and you can die from lack of oxygen. Okay. Shortens people's lives. Unfortunately, many people despise their CPAP machines. This is what's prescribed for them.
Okay.
And so we actually have some people referring to us, doctors whose patients will not wear their CPAP machines. And there are oral devices that can be made that make your jaw come forward, that makes your throat open up. Your throat should be like a big garden hose or a fire hose, let oxygen go down.
Have you had people that were on CPAP that are no longer on CPAP?
Oh yeah, that's pretty much what we do, are people that have failed their CPAP. The CPAP is the gold standard, and our appliances are what you pretty much use if you're not using CPAP.
So they breathe fine during the day, but when they lay down, their jaw drops back? I mean, it makes a logical sense.
It closes off. You ought to have it like a garden hose.
So you just kind of splint it out a little bit.
Pull this out and open that back up.
Is that right?
And then also when you do that, then whoever's in the house with you is so happy because they're not making all that snoring noise and everybody else can sleep. I'm not sure who's happy, the person who gets a good night's sleep and you're not tired all day, and because your brain's better, you're better at work, you feel so much better having a good night's sleep and oxygen all night, or anybody else in the house that actually got a good night's sleep too, because you're not snoring like a bull. Usually the wives are actually happy, more vocal about being happy than the people that we put the appliances in.
Now
some women too also have it.
So there are these sleep studies, medical sleep studies.
Oh yeah.
And they give them numbers.
Yes.
So do you have like before and afters where people medically, you can prove that they're sleeping more?
Yeah.
Is that right?
Yes, absolutely.
So it works?
Absolutely. Now, the thing that we tell people too is, when you put something in your mouth, it's like wearing braces or wearing your retainer after the braces. It may take a week or 2 or 3 before you get used to having it in there before you wear it all night. I've got one myself that I wear, and it took a couple of weeks before I was really happy wearing it all night. I've talked to a couple of people that said the first night they put it in, they felt so much better the next day, having had oxygen all night and had so much better energy. They wore it all night from the first. So everybody's different. Don't have typical patients like we talked about before. But you certainly, if you're getting oxygen all night, you're going to feel a whole lot better tomorrow morning.